My name's Deb Reiland, and I'm a registered nurse. I've been a registered nurse for 30 years. And I got interested in parish nursing several years ago, but in May I went to a week-long training in Wisconsin. And the interesting thing, the LCMS Church really has a great organization. It's an international parish nursing. It's a specialty area. It's also called in the American Nurses Association faith community nursing, so you may hear that. But I'm interested in starting it. Part of the Affordable Care Act, part of it's our society. Health is important, and for us to promote health is really one of the goals behind this. Well, we need to look at our health in mind, body, and spirit. So it's more than just looking at health from a physical standpoint. And there's a wheel that we'll come to. It talks about the wholeness. So yourself as a wholeness. Christ has called us to wholeness. One of the things, really what we want to do is help, encourage, and help people to attain and maintain the highest level of wellness. So Christ has asked us to be whole, and part of that wholeness is the spiritual end of it. And as when we come to the wholeness wheel, as you'll see in a moment, the spiritual being is on the outside. So for us to be healthy, we need to be healthy not only physically, mentally, emotionally, intellectually, functionally, but spiritually, and that covers us through Christ. Well, there's 7 main roles that have been designated for a parish nurse in a congregation. One for sure is health advocate. Another one is coordinating the volunteers. Another one is health education, and that's one of the premises we have here. Coordinating support groups, helping with volunteers, being a health counselor if needed, personal health counselor, developer of support groups, and one of the main things is a referral agent to outside community resources. The idea of parish nurses is to integrate faith and health together. In nursing, you do that to an extent, but being within a parish and a congregation, that's the spiritual end is really the focus. That your health is related to your spiritual end, and really you're looking at all facets of health. Well, we could do health fairs. One of the main things that's really recommended is once a month have blood pressure checks during church, after church is over, in between during fellowship hour and before services as need be. Some of it is to catch problems, be preventive. We want to be preventive. We want to keep people healthy. So prevent maybe a stroke, prevent maybe a heart attack, prevent, and immunizations, that's what they are. They're prevention. They're to keep the health of a community or the congregation together. So we could do a health fair and have immunizations. We could, have blood work if you want. In fact, one of the folks talked about their lab technician, and they could analyze what the blood results were if that's what they... So we have a wealth of people in this congregation with medical backgrounds. We're asking for this survey. The survey is really the big push right now to find out what your needs are of the congregation. And so that's what we need you to do, is to fill out the survey in the next couple weeks, October 26th and November 2nd. There'll be 2 people in the gym during fellowship hour and right after the first service, and 2 people in the foyer after the first service. Then we'll have somebody in the gym right before the second service, the 11 o'clock service, and then we'll have someone in the foyer as the second service is discharged. We're hoping that you all fill a survey. It's confidential. We have a health ministry team that will do an analysis of the survey, and from there we're going to decide, based on what the information is, where we should go with this health ministry. And when we think about this, another passage was Matthew 25:35 through 36. For I was hungry, and you gave me something to eat. I was thirsty, and you gave me something to drink. I was a stranger, and you invited me in. I needed clothes, and you clothed me. I was sick, and you looked after me. And I was in prison, and you came to visit me. We have really wonderful ministries here, and this is just one to fulfill another part of our caring for each other in our congregation.